Hi, my name is Emmanuel Cruz Carrasco. I'm going to read chapters 30, the respiratory system, and chapter 34, basic investigations of the textbook Professional English Use in Medicine. Chapter 30, the respiratory system. A. Cough. Cough is a common symptom of upper respiratory tract infection, URTI, and lung disease. A cough may be productive where the patient coughs up a sputum, or non-productive where there is no sputum. A productive cough is often described as loose and a non-productive cough as dry. A sputum or phlegm may be clear or white, mucoid, yellow due to the presence of pus, purulent, or blood stain, as in hemoptysis. A doctor is examining a patient who is complaining of a cough. Doctor, how long have you had the cough? Mr. Hamilton, oh, 4 years. Doctor, do you smoke? Mr. Hamilton, I used to smoke heavily, but I gave up a year ago. Doctor, do you cough up any phlegm? Mr. Hamilton, yes. Doctor, what color is it? Mr. Hamilton, usually yellow. Doctor, have you ever noticed any blood in it? Mr. Hamilton, no. Doctor, any problems with your breathing? Mr. Hamilton, yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. The doctor writes in the patient's case notes, CO, dysphonia, and cough, C, purulent, sputum 4 years, no hemoptysis. Note, the noun phlegm is pronounced phlegm. B, auscultation. The doctor is examining Mr. Hamilton's chest. Take deep breaths in and out through your mouth. Good. Now say 99. Listening to the chest with a stethoscope may reveal the presence of sounds apart from the normal breath sounds. There are two main kinds of added sounds: crackles, which sound like hairs being rubbed together and suggest the presence of fluid in the lung. Wheezes, which are more musical sounds, like whistling, and indicate narrowing of the airways. The sound of an asthma patient's breathing is also called wheeze. The sound heard when the pleural surfaces are inflamed, as in pleurisy, is called a pleural rub. The doctor asked Mr. Hamilton to say 99 to check vocal resonance, which may be increased as in pneumonia or decreased as in pneumothorax. After examining Mr. Hamilton, the doctor adds to his notes OHS, early inspiratory crackles, both lung bases, plus expiratory wheeze. I'm going to read the exercises of chapter 30, the respiratory system. 30.1. Make word combinations using a word from each box. Look at A and B opposite to help you. Now I'm going to read the boxes. Box 1. Blood, breath, plural, productive, vocal. Box 2. Cough, rub, stain, resonant, sounds. Now I'm going to make the word combinations. Blood stain, breath sounds, plural rub, productive cough, vocal resonance. 30.2. Rewrite the questions using words that are better known to patients. Look at A opposite to help you. 1. Is your cough productive? Are you the rewarding is are you coughing up phlegm? 2. What color is the sputum? How does the phlegm look? 3. Is it ever purulent? Is it yellow? 4. Have you ever had hemoptysis? Have you coughed up blood in the phlegm? 5. Do you suffer from dysphonia? Do you have trouble breathing walking upstairs? 30.3. Are the following statements true or false? Give reasons for your answers. Use your medical knowledge and A and B opposite to help you. 1. A patient who has a low cough produces phlegm. This statement is true. because when one is coughing up and you produce phlegm, this means your respiratory system is functioning okay, and you can the virus is trapped there, and you can expel it. 2. Crackers are heard when the airways are narrow. This is false. Crackers are heard, like we saw in A opposite, is where there is fluid in the lungs, like there's a water or blood. Crackers are heard. Know where the airways are narrow. The sound that is heard when the airways are narrow is a wheezing sound. Or that is like a musical sound like wheezing. 3. A patient who has a non-productive cough process sputum. This statement is false. Because when a patient has a non-productive cough, he doesn't produce sputum because the sputum are the bacteria or infection, anything that the body trapped there for the body to expel it. This non-productive cough is dry, is is not with phlegm. There is no expelling. Your cough is only expelling air. 4. Wheezes are typical of pleurisy. This statement is false because according to chapter B, this is the sound heard when the person inflamed is a pleural rub. In pleurisy, no wheezing, because wheezing is when the airways are narrow. So this statement, the fourth statement, is false. 5. A pleural rub is a sign of asthma. This statement is false. A pleural rub is a sign of pleurisy, not asthma. Wheezing is a sign, can be a sign, or a wheeze sound can be a sign of asthma, but a pleural rub is not a sign of asthma, it's a sign of pleurisy. Now I'm going to repeat it again, but with only the true and false statement. 1. A patient who has a loose cough produces phlegm. True. 2. Crackers are heard when the airways are narrow. False. 3. A patient who has a non-productive cough produces sputum. False. 4. Wheezes are typical of pleurisy. False. 5. A pleural rub is a sign of asthma. False. Now I'm going to read Chapter 34, Basic Investigations. A. Ophthalmoscopy. An ophthalmoscope allows the doctor to examine all parts of the eye, the iris, lens, retina, and optic disc. For best results, the examination is done with dim or lower lights to allow the pupil to maximally dilate or widen. A topical mydriatic solution may be applied to the eye to aid dilation. The patient is then asked to fixate on a target for the duration of the test. Here we have a photo of ophthalmoscopy. And here is the ophthalmoscope. Direct ophthalmoscopy. B. Blood pressure. Here we have illustration of the basic investigations tools. Here you have a sphygmomanometer, the gauge, the cuff, the valve, and the pump. The sphygmomanometer is used to see the blood pressure. Here you have a stethoscope. Here you have the earpieces, the headpiece, the bell, and the diaphragm. Sorry for the text in the illustrations being mirrored in the video. A stethoscope is used to hear long and hard sounds, or the sounds around the chest and back area, even in the abdomen, stomach, chest, all this area, the trunk mainly, or to hear the sound in the veins or the arm. A stethoscope is used to hear the sounds of blood rushing back through the artery. The first thumping sound is the systolic blood pressure, SBP. When the thumping sound is no longer heard, that's the diastolic blood pressure, DBP. C. Taking blood. During venipuncture, the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner parts of the elbow, the antecubital fossa, which is easily accessible. She may apply a tourniquet, a tight band above the site, or the patient may be asked to clench their hand to make a fist, in order to make the vein more prominent. Afterwards, the patient may be asked to press lightly on a dressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and a hematoma, a black and blue mark or a bruise, where the vein was punctured. Note, a bruise is a specific mark. Bruising can be used to describe a number of bruises or a larger area. The patient exhibited bruising on the right forearm. The antecubital fossa is around this area. And the phlebotomist can ask you to make a fist or make a tourniquet about this in the arm, so the vein can be more visible. Now I'm going to read exercises of chapter 34, basic investigations. 34.1. A doctor is talking to a patient during ophthalmoscopy. Match the underlying expressions she uses, 1 through 4, to expressions with similar meanings from A opposite, A through D. Right, and now I'm going to read the examination of the doctor, the ophthalmoscopy, and then I'm going to make the matches. Right, Mr. Gold, because you have been having this headache, I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now I would like you to look straight ahead at the clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me, look at the clock. Now I'm going to make the matches. First match. 1. A couple of drops is B. A topical mydriatic solution. 2. Which will make it easier for me to see the retina. The match is C. To aid dilation. 3. I need to get rid of as much external light as possible. This means closing the blinds. The match is A. The examination is done with dim lights. 4. Look straight ahead at the clock. The match is D. Fixate on a target. 34.2. Complete the instructions. Look at P opposite to help you. 1. Wrap the cuff around the patient's upper arm. 2. Place the belt over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. 3. Close the valve on the pump. 4. Pump up the pressure to at least 150 millimeters of mercury. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. 5. The first sound you hear is the flow of blood through the brachial artery. The value on the gauge at that point is the systolic blood pressure. 6. Continue listening while you slowly pump the cuff. 7. The diastolic blood pressure is measured when the sound completely disappears. 34.3. Complete the test. Look at the text. Look at the opposite to help you. 1. Phlebotomists are especially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied, and the patient is asked to press gently. This helps to stop the bleeding and prevent hematoma at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out. So those were chapters 30, the respiratory system, and chapter 34, basic investigations of the textbook Professional English Used in Medicine. So thank you very much for your attention. So that was the video.